All right, we are returning. The issue here of how the president has himself undermined his own signature piece of legislation is really a clear indication of how insane this entire thing has gotten. Because right now, what we're finding out is that the administration itself is destroying the Obamacare implementation by their complete and utter lack of inability to implement it themselves, and they're flailing about like panic-stricken deer in a cage. You know, they strong-armed us into this thing initially, and now they're busy flaunting it and flouting it and bypassing it themselves. How are they doing that? Well, we know that the administration has given itself and its cronies many waivers. They gave waivers to Congress itself just a couple of weeks ago through a presidential order, no less. Now, you know, you cannot have a presidential order that tells administration organizations to not apply the law. Folks, that is so far outside the boundaries of what we can accept as a nation that we have to say that that's inexcusable. And Congress, frankly, has really got my head in a tailspin over the fact that they're the ones who requested this for their own personal benefit. I mean, you want to talk about a bunch of elitist pukes. There is the perfect example. But secondarily, this thing is then they gave the unions a bunch of waivers. Then they gave waivers to a bunch of their corporate cronies and these larger corporations. Then they restricted the corporations from having to implement it at all for the first year. Meanwhile, saying you, as the average American, have to implement it. There's no way on board the system where you can identify the fact that individuals are required to have it because their corporation does or does not supply health care insurance. And so it's a boondoggle because you're required to adhere to a law that they can't prove or disprove you even followed, and or whether or not you're required to submit in the first place. That's the insanity of this. Now, on top of that, we also know that corporations and businesses in general are cutting all of their employees below full-time employment for the express purposes of avoiding Obamacare. And the administration has the unmitigated gall to come out and say, well, that's really just anecdotal. Anecdotal, my foot. That is a blatant and absolute lie. The reports are everywhere. Every industry is reporting that we are losing full-time jobs in massive droves. Every company, every organization, every industry is cutting their staff from full-time to part-time to avoid this monstrosity of a law. And I got to tell you, if you don't understand and recognize the danger that poses to the American workforce, I don't care how sycophantic you are in your support for Obama and this administration, nobody can deny that it's destroying the barely blipping life scan of our employment system right now. I mean, we're not even really registering. We're on life support. And this administration has been so deleterious that, and designed this thing this way, by the way, because it forces everyone out of employer-based insurance and into single-payer system. In fact, Reid came out the other day and said that the goal of Obamacare is to end up being the federal government is the national source for all health insurance. Single payer, universal health insurance promoted and provided by government. That was the idea all along. Everybody screamed about it in the beginning, and then Congress went ahead and passed it anyway. I mean, this is so insane. The limits, by the way, and then to make matters worse on the implementation of this, that the insurance companies on October 1st were supposed to be able to were supposed to be forced at that point to cap the total cost of the premiums that they could charge you. In other words, when the law went into effect on October 1, the insurance companies at that point, if they hadn't raised their rates, then they couldn't raise them at all. In other words, they were forced to live within those rate structures that they'd gotten. Which is why, by the way, you're seeing insurance premiums go up in state after state after state. 20, 30, 100, 150, 400%. A 400% increase? And you're going to try and tell me that's not gouging? Come on, man. I mean, look, I was born at night, but it wasn't last night. So what we have is the insurance companies were, and that limitation was just lifted. The insurance companies were supposed to be barred from changing rates on the 1st of October. But now they've been given another year's worth of amnesty to continue to raise rates while Obamacare is implemented. What that means is that it's cheating. Because the insurance companies are now going to have an opportunity to evaluate over the course of this first year exactly how much money it's going to cost them to implement this boondoggle. And then they're going to turn around and they're going to pad that and buffer that with an overage for bad numbers, a fudge factor, if you will. And then they're going to turn around and slam that on the American people. And they've got a year's worth of advanced knowledge and notice on what is and is not going to work and how much it's going to cost them so that they can turn around and shaft us. I got to tell you, this thing is so fraught with so many boondoggle holes. The security system isn't ready. The insurers aren't ready. Congress isn't ready. Industry's not ready. America's not ready. America doesn't want it. And we're getting it anyway. People, if that is not the definition of tyranny and a dictatorial totalitarian regime, I don't know what more you're waiting for. The sharp limits on Americans' out-of-pocket costs for health care, suspended. I mean, you got to be kidding me. The law the laws dictate that people apply for federal subsidies to buy insurance, provide proof that they're eligible to the government, scaled back, but only for employers, not regular Joes who are not either offered employment by their insurance company or don't have any insurance at all or what have you. 10,000 members of Congress and staff, 10,000 waiver. Unions wavered. Huge corporate cronies wavered. I mean, is this insane or is this insane? This is a huge, a complex, massive undertaking that was poorly conceived, poorly designed, and really, so far outside the scope of what America wanted that really we shouldn't even be entertaining it. And that's why I keep promoting this concept. The right way to defeat Obamacare is simply to say, just say no. Don't sign up. Refuse in massive numbers. Stop talking about repeal. I don't care. Congress ain't going to do it. So let's stop wasting our breath on that. And let us start putting our attention and our focus to a campaign to educate all of America that signing up for Obamacare is sealing your own death warrant in a number of areas. And let's cut over what they are. One, the independence of you and your doctor to be able to determine what your own health care needs are. Two, the ability for you to have your insurance company actually pay for a lot of the services that you need. Three, the fact that you are going to be that your information in this data hub is completely insecure and you're going to be robbed of everything that you consider to be private. Your personal insurance information, your health care information, and your financial information, and your IRS tax returns. I mean, this stuff is so bad that I can't believe that more Americans are not cognizant and aware of the importance of just saying no. So I don't want to talk about repeal anymore. The House has voted to repeal Obamacare 40 separate times. 40. Harry Reid, the traitor in the Senate, won't even let that come up to a floor vote, which tells you that he's scared. And who is Harry Reid, by the way, that the entire country is stalled by the likes of that scumbag, Harry Reid? Who is this guy that we've allowed him to usurp such immense power that a bill can't even come up for a discussion unless he personally approves it? I mean, really, people? At what point do we have to say, this is insane. This is not the United States of America. This is not the government we want. This is not the Congress we want. This is the cause of the gridlock they keep blaming on the conservatives. In fact, it's not the conservatives at all. It's Harry Reid. It is Harry Reid. Individually and singularly blocking access to bill after bill after bill after bill that he doesn't personally or ideologically agree with. I mean, that's really crazy. And I'm not saying Boehner can't do the same thing in the House. He can. But I am saying that it's time for us to break this logjam with Congress and say, it's not up to you to whether or not a bill actually hits the floor. All of them hit the floor. You discuss all of them, and then you move forward on them. The process by which a bill gets approved is completely out of context with reality. And so that's how Obamacare got through. That's why we can't change it, even though everyone in America, now, and I'm not going to give you the lie that Obama will say you. 90% of Americans want this. But we do know that about 65 to 70% of Americans don't think Obamacare and its implementation is either a good idea or ready to go. Now, folks, that is a clear mandate that Congress should be acknowledging and honoring. When you've got 65% of the population, and that includes the takers, the looters, and the makers, who are all saying, this thing ain't ready for prime time, we should be expecting Congress to take action based upon that. There is there's a story in Forbes this morning that there's an unpublished memo out there that the Obama administration has missed half of Obamacare's legally imposed implementation deadlines. Half. I'm going to read you a piece of it. In recent months, President Obama and his subordinates have waived or delayed a number of Obamacare notable features, such as the law's employer mandate and its procedures for protecting taxpayers from fraud and identity theft. Forbes is hitting on exactly the stuff I've been hammering on for weeks now. Earlier this month, in that context, I obtained a heretofore unpublished memorandum from the Congressional Research Service. The Congressional Research Service is Congress's nonpartisan in-house think tank, and it compiled 82 deadlines that the Affordable Care Act mandates upon the first 3 years of its own implementation. Remarkably, it turns out that the White House has missed half of all of those deadlines legally required by the ACA, and some of those deadlines remain unmet to this day. So they have a chart in here, and I encourage you to see this. It's up on our Facebook page, which you can find by going to facebook.com/America's Voice Now, and on our YouTube channel, which you can go to, on our website, which is americasvoicenow.org. And then you can share this video with friends of yours through YouTube, which you can go to by going to youtube.com/America's Voice Now. The completed on, they went through all of these different compliance deadlines that were supposed to be done in the first 3 years. And the completed on time or early, there were 32. There were 17 that were completed late. There were 24 that haven't been completed at all, even though the date is long past and they still haven't been completed. And then there are 9 more that have not been completed due to lack of congressional appropriation of money. Now, this report is dated June 5th in 2013, so it's only 2 months old. And it's an addendum to a series of previous reports in which the administration examined missed deadlines during the first 2 years. 41 out of 82 deadlines have been missed. 41 out of 82. I mean, this is for a project that takes over 1/6 of our national economy and 100% of the health care of Americans, and opens us up to fraud and abuse on a scale that heretofore we have never seen. I gotta say, this is the snake eating itself by the tail. Think about this. 1/6 of our economy is wrapped up in healthcare. It is a critical aspect to the senior community that this, the liberals espouse that they are so supportive and protective of. I mean, who's going to pay the penalty here when Obamacare melts down after 6 months or 12 months or 18 months of implementation? Because this thing is so goofed up, it's like the Keystone Cops. The inmates are running the asylum. So who's going to pay the price when this thing goes into meltdown? And there is no way for us to back out of it at that point. I'm asking you, you seniors out there who are on Medicare and who are on Medicaid, what are you going to do? What are you going to do when there is no health care? Because hospitals and doctors say, look, this thing is so bad, I've just decided I'm not going to play a part in it anymore. And if you don't have private health insurance, we can't get paid from them. They don't know what they're doing. This thing is a disaster. So if you don't have private health insurance or you don't pay cash, we're not taking patients. What are you going to do when they say that? Because that is what's going to happen. That must happen, and I'll tell you why. Hospitals and doctors are not going to work for free. And no amount of gun pointing, no amount of coercion, no amount of force is going to make them do so. The senior doctors in our communities are going to retire, or they're just going to pack up their stuff and call it quits. Or they're going to switch their practice from insured types of practice to basically cash only. That's what's going to happen. I bet you are going to see, within the first 12 months of implementation, a host of news stories about doctors who are saying, we're a community we're in a medical community area here. And what we're going to do is we're going to form a co-op, a local co-op. I bet you money this is coming. You're going to see co-ops, healthcare co-ops, springing up all over the country. And they are not going to have anything to do with government healthcare. If you want to play, you're going to have to join the co-op and pay a premium, if you will. And you're going to go to, there are going to be 6 or 8 doctors in the town or the city or the community that's involved in this. And you're going to work within that small group of specialists and general practitioners. Frankly, I'm surprised doctors haven't begun doing this already. I would love to see an association of medical professionals get up and say, okay, you're a general practitioner, and we need about 10 of those. We need 5 or 6 anesthesiologists. We need 5 or 6 radiologists. We need 4 or 5, specialists in neurology or whatever the case may be. We're going to form a group, a professional corporation, a professional organization. And instead of dealing with the debacle of Obamacare or dealing with the theft from these health insurance companies, what we're going to say is you can come in here and you can pay us a group of 50 or 75 or 100 doctors. You can pay us a premium. And when you come in here, it's a one-stop shop. Whether or not you come in here and you've got a sneeze and you need antibiotics for your kid because he's got something, or whether or not you've broken an arm, or whether or not you need you need surgery, or you need cancer treatment, or whatever the case may be. You watch and see. This is a prediction. You're going to see professional corporations spring up with communities of medical professionals who are going to get together and organize and say, it's a one-stop shop, like you would get at Sam's Club. Come in here, and it doesn't matter whether you want popcorn, peanuts, or whether you want a canoe or you want tires for your car. We serve it all. And in order to be a member here, you got to pay a fee. And we don't take insurance, and we don't deal with any governments, and we don't deal with Obamacare. You watch and see what happens. Now, the first thing that's going to happen is the Fed is going to try to crack down on them and throw all kinds of regulations in their way to prohibit and bar them from making it happen. But I'm telling you right now, you're going to start seeing it. Unless the federal government has some kind of legislation or persecutes these groups, that's what we're going to see. And I for one, believe it's probably the best thing that could happen. Because that, when you were a kid growing up, what happened? They didn't have a health insurance in the 60s and 70s and even into the 80s. You went to a family doctor. First of all, doctors' costs and hospital costs weren't so astronomical that they cost you your life savings. Even if you needed oncology or some kind of specialty treatment, it didn't cost you literally hundreds of thousands or even millions of dollars to get cured of a problem. And they weren't as influenced by the drug companies, and they weren't as influenced by all of these companies that are forcing them to, hand out pills by the bucket and so forth and so on. It was better then. And there is no way that government can replace or replicate what the free market did then. When you went to the family doctor, you got treated. If you didn't have the money to pay, in many cases, our family, when I was a kid growing up, we always had a balance with the doctor. 5 boys, no girls. We always had five children and 2 adults. We always had a balance with the family doctor. Somebody was always sick. Somebody had fallen and broken this or scraped that or had stitches for this or whatever the case may be. We always had a balance. It was never astronomical, but every month we paid on it. And it was like paying insurance. That was the health care of then. And I got to tell you, I don't see that today's health care system is significantly better than that health care system was. It's not. And this is only making matters more complex, more comprehensive, bigger, fatter, full of more fraud, more abuse, more theft. The opportunities anytime government gets involved and bureaucrats get involved is so astronomical for theft and fraud and abuse that we can't even comprehend how serious this is going to be. I'm going to make another prediction. If Obamacare actually does go into implementation, within the first 2 years, you're going to see so much fraud and abuse, they're not even going to know how to handle it. And what's worse is that now with the new propaganda laws in place, you're likely to not find out about it until whistleblowers start coming forward. And of course, they'll turn around and promptly prosecute them. I mean, it's going to be no different than the NSA stuff. You're going to have whistleblowers who are going to blow on the medical industry and the healthcare industry. And they're going to have to be moving to Sweden because the Obama administration is going to be chasing them around with a sharpened stick. I mean, come on, people. These deadlines haven't been hit for a reason. This thing is so mammoth in its size that they're never going to be able to hit all of their targets. There is no way that they're going to be able to realistically and accurately make the Affordable Care Act work. I'm telling you right now. And it's anything but affordable. I mean, already people are seeing their insurance and premiums, those who have them, go through the roof. The companies are seeing them go through the roof, and they're figuring out mitigating strategies to say, we're just not going to offer health insurance anymore. You're going to have to go on the exchange in your state. That's what's happening, people. Or, worse yet, the companies are saying, we have 211 full-time employees and 75 part-timers. Now we're going to switch that, and we're going to have 300 part-timers and no full-timers, except for the maybe senior management. That's what they're doing. That forces all of those people to then go on to the healthcare exchange. The healthcare exchange is designed and geared to end up making it so that only the federal government is in charge of healthcare. Whether it's payment, whether it's what procedures are functional, all of it is geared and designed to be centered and focused on federal government usurping more authority and power and more ability to manipulate the citizenry of the United States of America. And you can say anything you want. You can try to pitch differently all you want. I'm telling you right now, that's what this is all about. The answer is simple, folks. Just say no. You will not participate in Obamacare. You won't sign up. And we will do everything in our power within the law to actively work and to sabotage the law. Sabotage it. Legally, but sabotage it. All right. Find us on americasvoicenow.org. Find us on youtube.com/AmericasVoiceNow. And then find our Facebook page at facebook.com/AmericasVoiceNow. Next segments, we're going to talk about polygraph prosecutions, how the government is prosecuting polygraph experts who are teaching people how to beat the system, and how we've got to rein in this militaristic cop thing. I mean, this is so far out of control, guys. We're in trouble.